Joining us today is SBCA legal counsel Kent Pagel, president of Pagel, Davis & Hill. Kent is going to start by providing guidance for component manufacturers on how to deal with the COVID-19 coronavirus. He will then yield the rest of his time to answer your specific questions. Kent, I'll turn it over to you.
Thanks, Sean. Good afternoon, everyone. Today's session will primarily deal with employment issues that component manufacturers are facing with respect to what we call the COVID-19 coronavirus. Sean, next slide, please. COVID-19, as many of you probably know, is not a flu. It's a respiratory disease caused by a virus. It's one of the 7 known coronaviruses that exist. And importantly, from the employer's perspective, earlier this month, the World Health Organization declared the current coronavirus outbreak, COVID-19, as a pandemic. And as a pandemic, you'll see that does give some, or the employer, some additional prerogatives. Next slide, please, Sean. A pandemic, really, the criteria is little or no immunity in the human population, causes serious illnesses, and is very easily spread person to person, which we've seen with China, Italy, Spain, and to some extent here in the United States. The assessment of a pandemic by the World Health Organization and also by CDC here in the United States, as indicated earlier, gives the employers some additional flexibility with respect to their interaction and their involvement with their employees. Let's go to the next slide, please. So when we talk about COVID-19, and this may be old news to some of you who have spent your time watching CNN or Fox News or looking at the internet, but the symptoms are a few. They include fever, cough, shortness of breath, and generally just respiratory ailments. And the illnesses can range from mild to the point where people don't even realize they have the virus to severe. And as we've received, or at least see in the media, you can see some deaths as a result of this particular virus. Now, symptoms, I heard last night there's a 2% rule that people are following, that within 2 days, 2% of the population that are exposed to the virus will show symptoms, and by day 11, no more than 2% will show symptoms. So most of the symptoms are discovered within days 3 and 10 of the initial exposure. Technically, it's 2 to 14, but I think the rule of thumb, if you follow the 2% rule, is 3 to 10 days after exposure. The virus spreads from infected people to others who become infected through coughing and sneezing. It's essentially the droplets that come as a result of coughing and sneezing, either directly to an infected person or to another person, or left on a surface where the uninfected person picks up the virus by touching a source of equipment, or maybe at the gym, they pick it up touching a countertop or wherever. Now, understand the difference between symptomatic spread and asymptomatic spread. Most experts will tell you that the virus is only spread with those people that show symptoms. But one of the reasons we're seeing all this noise and information regarding social distancing is largely because of the asymptomatic potential spread. There are some experts out there that have pointed to some studies. I still think this is not necessarily factual at this point in time, but something we need to consider, that the disease can in fact be spread from people who are infected with it but show no symptoms. And thus the reason we're seeing a lot of social distancing out there in the marketplace. Okay, let's go to the next slide, please. Okay, steps that employers can take to reduce employee exposure. First of all, we think it's important that companies consider developing a infectious or contagious disease preparedness and response plan. Think of it as an additional policy that becomes part of your employment handbook. Here, my office has worked on a contagious disease policy for some clients, and we're going to have available for SBCA members either later today or tomorrow a draft policy that could be considered to be adopted by employers, SBCA members, and it could be developed or modified as companies see fit. This will be made available at no charge for members, and there'll be a reasonable charge for non-members. So look for that after today's webinar if you're interested in having that policy utilized by your particular company. I will also point out, and you'll see that image to the right of this particular screen, OSHA has recently published guidance on preparing workplaces for COVID-19. Many of the things that you see in today's presentation and some other things are set out in this guide. The one positive takeaway from the guide from the perspective of truss manufacturers is that if you look at the classifications of exposure risk, truss manufacturer employees would have what OSHA describes as a low exposure risk as compared to a very high exposure risk, or what OSHA calls high exposure risk, or even a medium exposure risk. So compare what truss manufacturer employees, the risks that they face at the truss facilities, designing and manufacturing and delivering trusses as compared to healthcare workers, for example. And you can see that obviously healthcare workers and first responders are going to be those people that have the very high exposure risk. So the category of employees working for us would fall into the low exposure risk. Nevertheless, I think as evident by the number of attendees we have today, I think it's an issue that a lot of us have a strong interest in, and that truss manufacturers need to pay particular attention to. So let's go to the next slide as well. Okay, steps you can take if an employee of yours appears sick. We would caution you to first not overreact and create a panic among your workforce. So train your supervisors to tread carefully. A fever or difficulty in breathing does not automatically equal COVID-19 coronavirus. Many of us this time of year, especially in the Midwest and North, are having colds. Some of us may actually have the flu. Some of us have allergies in the South, where we've got pollen robustly out there in the air, as you can see by looking at your car and having to wash your car every day. So don't assume that a fever or difficulty in breathing is automatically equal to a person having the coronavirus. You're going to hear people cough and sneeze and do whatever this time of year. It's going to be common. Now, one thing that we need to know is that employees who do in fact exhibit these influenza-like symptoms, coughing, sneezing, at work during a pandemic can be sent home. And if there's a fever in particular, they should be sent home. That's something that during a pandemic, an employer has the right to do with respect to any of their employees. And we'll talk about this in some more detail as we get into this presentation. Let's go to the next slide, please. Okay, it's important for employers to communicate with their employees with respect to whether or not they have symptoms. Encourage employees that feel sick, whether it's fever or respiratory ailments, to not come to work, instead get medical attention, and if possible, get tested for the coronavirus, COVID-19. During a pandemic, the Equal Employment Opportunity Commission has advised that telling workers to go home is not a disability-related event if the symptoms exist that are common to, what we're seeing with respect to coronavirus, COVID-19, which is similar to the flu or the H1N1 virus that we saw a few years back. So EEOC has given opinions that telling workers to go home if they present symptoms is not a disability-related event and will not subject you to a complaint filed by an employee with EEOC. Therefore, you can send employees home if they exhibit any kind of, it says symptoms here on the slide, it's a typo, or symptoms of the virus COVID-19. Next slide, please. Okay, so if an employee appears sick during the pandemic that we currently are undergoing or going through, another option for employers is to take an employee's temperature at work. While taking a temperature of an employee is considered a medical examination under the American with Disabilities Act, the EEOC, which is also a United States governmental organization, allows, given the pandemic situation that we're currently involved in, for this to be done without a finding of direct threat. Therefore, as I've indicated, much like telling an employee they can go or they should go home if they exhibit fever or respiratory problems while at work, you can take their temperature. I would point out that I just learned either yesterday or the day before, I think yesterday, that anybody who is meeting with or talking directly to President Trump, for example, is having their temperature taken. That's a sign that people believe having a fever is one of the best ways to determine whether or not people you're interacting with potentially have the COVID-19 virus. If an employee refuses to have their temperature taken, you have the right to send them home. We have worked on, like I've indicated, a few contagious disease policies as part of employment handbooks. And we are taking two approaches with respect to these employment handbooks. One is to technically give the employee the right to consent to having their temperature taken. But if they refuse, the employer reserves the right to send them home. We also are recommending to everyone that they not maintain a written record of names, employees' names, and temperature readings. Simply have their temperature taken. If the temperature exceeds the level that CDC recommends, then you should send them home or have them go see a medical provider, healthcare provider. And that temperature reading right now, from best I can tell, based on my review of the CDC, is 100.4 degrees or higher. So don't use 98.6 as the threshold. It seems to me that CDC is using 100.4 degrees as the threshold. You also may want to consider, and this goes beyond just employer-employee relations, but the same thing with respect to any visitors to your trust plant, whether it's a vendor, whether it's a prospective employee, whether it's a governmental official, that you not allow that visitor to enter the facility and interact with your employees unless they have their temperature read. And you may want to have a questionnaire presented to that visitor that asks whether or not they've been in the countries such as South Korea, China, Italy, those types of countries that are high on the list of where people have been found to have a high likelihood of COVID-19. Have them fill out this questionnaire, and then as part of allowing them to enter the facility and interact with your employees, have them have their temperature taken as well. So that's a pretty good best practice, relatively inexpensive, not too difficult to do, is to have the temperature taken of employees as they arrive to work. That is a permissible activity as indicated by EEOC as well. Okay, so let's go to the next slide, please.
Kent, there's a quick question with regard to taking temperature. The question was asked, does the person taking an employee's temperature need to have any kind of training or certification?
I'm not aware of any training being required. I don't think it's all that difficult to take a temperature reading. I would use the old-fashioned thermometer. There's ways to, and I'm not the expert on the different kind of thermometers that are available, but I do believe there are industrial thermometers that one can acquire that make it relatively easy to take one's temperature. Okay, steps to take if an employee has the COVID-19 virus or has been exposed to somebody that has the COVID-19 virus. First of all, any employee of yours who has the virus should not be working at your company's workplace. Once you've determined whether it's through the employee telling you or from a medical provider or from a temperature reading that the employee is infected, you should undertake an investigation, try to learn from that infected employee, other employees within the company who've had close proximity to the employee for the previous 14 days. And I know this is, it's a large issue to think about. Proximity of 6 feet for previous 14 days could be a great number of people. You have to use common sense as you evaluate this. As part of that process, you may want to inquire with respect to the employee how long they've had symptoms and focus primarily on that time period that the employees had symptoms and find out those employees that they work closely with, and then strongly consider sending the employees who are not necessarily infected home as well, self-quarantined. You hear that term in the news and the materials that we're all reading, trying to separate those employees who may potentially have been infected by an infected employee is the goal of this social distancing that we keep hearing and talking about in the news. So investigate and then strongly consider sending others who were closely involved with an infected employee home as well to avoid the spread. It's also important for HIPAA rules that we maintain the confidentiality of the infected employee. That's something that, while it's difficult to assess what the long-term risk would be of not maintaining confidentiality given the pandemic that we're involved in, if we can maintain that confidentiality, that would be a good thing. After you have, and hopefully no one has to go through this process, but if you do have an infected employee and that employee is now either at home or in a hospital or under the care of a healthcare provider, it's important to undergo a thorough cleaning in the areas that employee may have worked. You may want to consider a third-party cleaning service to come in, and it seems to me that what CDC and others are recommending is disinfectants. They work well, but that you do a deep, thorough clean after an employee you learn has worked in your workplace and has been infected by this particular virus. Okay, let's go to the next slide, please. So as I've indicated before, CDC is advising companies to send home those that have worked closely with an infected employee for a quote-unquote 14-day period of time, although this 2% rule suggests that most of those people that have been exposed are likely to show symptoms by day 11. Now, this issue of exposure can get pretty complicated and difficult to assess. And I'll give you a hypothetical that existed with one of my employees. Over the weekend, we learned that this employee had met with her, or had dinner with her mother, and had interacted with her brother over a course of a week prior, and then it found out that her brother and his family had very close interaction with an infected employee here in the Houston area, or not employee, but an infected person in the Houston area. So the question became, how far must one go to this issue of self-quarantine? Is it only people that had direct exposure with infected employees, or does it go beyond that? If you've interacted with a person who has interacted with an infected person, is it required for you to self-quarantine? And we're learning just sort of day by day that health officials and medical providers are saying, no, it's not necessary to self-quarantine if you've interacted with somebody who has in fact interacted with an infected person. Key is whether or not the person you're interacting with is infected with the virus. If they're symptomatic, that's quite easy, or easier to make that assessment. If they're asymptomatic, it's far more difficult. So you're going to have to use common sense here. But if you have strong reasons to suspect that a person might be infected, or an employee might be infected, even though they don't show the symptoms, you may want to treat this situation as a confirmed case for purposes of at least sending that person home. And then you also need to keep open a line of communication with your workers so that they understand why people are being sent home, and that if a person was sent home, for example, who was not infected, that they understand that that person was not infected, but that the company's acting in an abundance of caution based on where things stand right now in terms of, can this virus be spread from people only with symptoms, or can it likewise be spread with people that are asymptomatic? So that's where we currently are in terms of trying to make recommendations for companies and for people generally. Okay, let's go to the next slide, please.
Kent, there's one question of, if someone is aware of a positive case and who that person was in contact with, who should they advise on that? Is there somebody they should be telling?
I mean, if one of your employees knows that another employee potentially is infected, should they advise management of that fact? Is that essentially the question?
They didn't make it clear whether or not it's an employee or not, but let's assume so.
I think that if a company has strong evidence that an employee within their company may have this virus based on what some third party may have told them, or what some other employee may have told them, I think they have an obligation to investigate. And one of the best things they can do is sit them down and talk to them about, are they showing symptoms, and have their temperature read. I think you can't just ignore it, but because I think the whole plan right here is to flatten this curve of exposure in terms of the number of people that are being diagnosed with the with the virus, so that if you learn of somebody within your company that may have it, I think you want to find out and be more cautious, maybe overly conservative, by having that person self-quarantine or at least be tested by a medical or health care provider, because the last thing you want is to have an employee inside your company who has the infection and spread it to a number of other employees. So that would be my recommendation on that. Now, the next slide, please, Sean. Health employer, public health authorities slide.
Sure.
Do employers have an obligation to report to CDC or to state or local authorities, health authorities, that one of their employees has the COVID-19? A number of people have asked me this question. The answer is we are not aware of any requirement that a employer, a truss manufacturer, would have any obligation to report to CDC of a positive finding of COVID-19. That responsibility exists with the healthcare provider to notify authorities of any potential positive test result. So that if you have knowledge or an employee who has a fever over 100.4 degrees and you send that employee home, you have no obligation to notify health authorities. That employee may never, in fact, get tested. That employee may choose to get tested, might find out he does not have the virus and would provide that test result or at least a doctor's clearance letter so they can come back to work. But there would not be an obligation on your part to notify the authorities. Now, I bring this up because it's yet to be seen, really, to a large degree, what will happen if employers, or if the government learns that a particular company has one or two or more employees within that company infected, and what they may choose to do in terms of shutting down that company or putting strong requirements on that company with respect to its operations. So my way of looking at this is we have obligations to our shareholders, we have obligations to our employees. Let's meet our obligations that we have to both. Let's let the medical health care providers do their thing. Let's let the government and public health authorities do their thing. But let's not unnecessarily expose ourselves to a potential shutdown if there's a possibility that one of our employees has this virus. Now, that's my perspective on that particular issue, and I throw that out as a legal recommendation in the event that you do learn that one of your employees has this virus. Let's go to the next slide, please. Okay, steps employers can take to minimize the risk of transmission. Communicate to your employees verbally, and potentially, I've seen everywhere I go now, I see signs in terms of what people are supposed to do. If I go to a restaurant, I see a sign. If I go to my gym, I see a sign. If I go to my website for the airlines, I see a sign. But tell your employees to stay home if they're sick. If they have respiratory ailments and a fever, tell them to stay home. Don't require a health care note from that employee as a condition for them to stay home. You may want to ask them to provide that at some point in time if there's a plan for them to continue to stay home for quite some time, but don't make that as a condition for them to stay at home. So first and foremost, tell your employees to stay at home if they're sick. Advise your employees the importance of washing their hands. We've heard about this. Wash for 20 seconds. If you don't have soap and water, use an alcohol-based hand sanitizer. Employees should be advised to not touch their eyes, their nose, and their mouth with unwashed hands. You gotta grab your face, make sure you wash your hands first. Avoid close contact with others who are sick. Refrain from shaking hands. I think it's incumbent on us as employers to increase the frequency of how often we clean and disinfect common surfaces. Publish these requirements. Like I said, if it's a sign or notes or email distribution to your employees, publish them. I will also point out that keep in mind that many of us are using temporary employment agencies to staff our production workforce. And I think it's incumbent on us, if we're using temporary employees, to have them follow these same requirements for these people that they provide to us. And if necessary, it's one of my recommendations and best practices in any event with respect to temporary employees, to have contracts with those temporary placement agencies in any event. And I would impose requirements such as this, what you see on this page, in the contract that you have with your temporary employment agencies as well. So don't just limit it to your full-time regular employees. Make sure it also applies to your temporary employees. Let's go to the next slide, Sean. Okay, steps we can take as employers to minimize the risk of transmission. The previous page was really steps that we can have our employees take. What steps can we as employers take to mitigate or minimize this risk of transmitting the coronavirus? We need to make available to our employees the ability to wash their hands, tepid water and soap, or at least hand sanitizing materials. We ought to accelerate our cleaning and custodial work. That may mean more frequently on a daily basis, or at least if done every second or third day, increase the frequency of how often that's done. And I'll talk about this second bullet point in some more detail here in a future slide, but at least for some of our staff, evaluate remote work. Telecommuting, I guess, is the new term, or telework. Consider that as a possibility for some of your staff. I know it's not a possibility for production workers, but it may be a way to allow less people to interact with each other and yet allow you to continue to get your work done and keep your company going. But I'll talk about that issue of remote work in just a minute in more detail. Consider staggering the times that your employees start and leave, staggering lunch and break periods. The thinking here is to minimize the number of people that would be in the common areas, such as your break rooms, your lunch rooms. This is really trying to break out this gathering of a number of people. Right now is not the time for team building. Right now is unless it's absolutely necessary and urgent, is not the time for safety meetings. It's not the time for gatherings. It's not the time for social events or activities at the plant with your employees. Now's the time to consider keeping those employees in smaller groups 6 feet apart, at least until we get past this this coronavirus issue. Last bullet point on this page is to consider developing a communication tree within your organization. What I'm really talking about here is, let's make sure the same message is being communicated to our employees. And to do that, let's have our supervisors getting their information on COVID-19 from one single point of contact within an organization that relates to the health and safety of our employees. So if you haven't already, develop a communication tree that makes sure that there's one person who's issuing common and consistent instructions to your staff as employees are being told how to prevent infection transmission. So consider that as well. Let's go to the next slide, please. Additional recommendations for employers. Can an employee legally refuse to work because they believe they're in danger of getting infected? The answer to that effectively is within a trust plant, as a trust manufacturing employee, you're not going to meet the imminent danger standard that would be necessary to meet, so an employee cannot refuse to work. If they do choose to refuse to work under most circumstances, that would be grounds for termination. Same thing, can an employee demand that they be provided with masks or a respirator as they do their job? The answer is no. Can they refuse to work without a mask? The answer is no. Can an employer refuse, and this would really apply to some of our employees, not necessarily all of them, but can you prohibit your employees in terms of where they're going to travel on their leisure time, their personal time? Generally speaking, you can't restrict your employees as this is a legal activity. And as a practical matter, I don't think that's going to come up as an issue for most employees. But as we'll talk about in just a minute, if there is a potential infected employee within your company, your ability to inquire of that employee in terms of where they have traveled is something you can do given the pandemic nature of this virus, and is one of the recommended things that we've suggested. So let's go to the next slide as well. This issue is getting a lot of press right now, whether or not an employee has the right to stay home because they can't work because schools are closed or their daycare facilities closed. And what rights do they have if they've got minor children at home, whether it's because the school's closed or the daycare facility's closed. To the extent you have existing paid leave for sick or personal leave policies, such employees more than likely would be entitled to utilize that kind of leave, depending, of course, on the policy. In the event they couldn't show up for work for at least a number of days that they have personal leave or paid sick leave, or if paid sick leave would even apply to whether children are at home. In terms of FMLA leave, this is the Family Medical Leave Act. That's a federal statute. Are they able to take FMLA leave because they have to care for children at home? And the answer is, generally speaking, FMLA leave is only for medical purposes. If they're trying to take FMLA leave for taking care of children at home, that would not apply. It potentially would apply, I suspect, if the child was infected with the virus themselves, although in that situation, you probably want that person and employee to be quarantined because they have an infected child at home. But they're not allowed to take leave to avoid the exposure to the virus. There is no federal law for non-federal employees that gives the right to an employee to take leave to essentially stay home and take care of healthy children. So that issue, or this issue of whether or not an employee has the right to seek leave for taking care of children at home, because it seems like the schools and daycare facilities, at least most of the schools, are closing for some protracted period of time, and more daycare facilities are closing. That may change both at a state level and potentially at a federal level. And I'll talk about that before we close, because the United States House of Representatives has just passed a bill that would require companies to give leave to employees to allow them to stay home to take care of their kids But that's not yet passed the Senate. It's not been signed by President Trump, but I'll talk about that before we end this presentation and give you some more details and facts on that. Let's go to the next slide, please. Okay, here's the slide that deals with this working at home, given the fact that we have the COVID-19 coronavirus outbreak. For some employers and some employees, this may make sense. Obviously, for our manufacturing employees and for supervisors and even maybe for design folks, inside sales folks, maybe even for accounting and administrative folks, this may not make sense. And then I think a company, if they don't have a remote work policy already in place, it may not be the time to try to adopt a policy. You have to think through whether or not it makes sense. If you haven't tested one out, do the employees have access to all the technology, whether it be a computer, whether it be high-speed internet, et cetera, for them to undertake activities away from the office? For example, if they were a truss designer, having a robust computer with high-speed internet access would be something that would be necessary. So think that through before you consider this issue. Now, it could very well be that we face some mandatory quarantines at a company workforce level. That's not happened yet. It may require us to adopt workforce remote policies. But right now, I would caution you to consider these bullet points that you see on this slide. I will tell you that some of the larger companies, my neighbor, for example, is the CFO for Chevron Pacific, obviously a large oil and gas company, and he tells me that Chevron is working remotely across the entire world. Obviously they're a large company and they have more flexibility and more assets and more ability to do this remote type of work. But you probably are going to start to see more and more companies, especially the larger companies, develop this kind of practice. But obviously for a manufacturing company, this would be far more difficult. Okay, let's go to the next slide, please. Just briefly on the issue of reminding us what our obligations are in terms of paying employees pursuant to the Fair Labor Standards Act, FLSA, which is a federal statute administered by the United States Department of Labor. As a refresher, we know that an employee ought to be either exempt or non-exempt. And our obligation with respect to non-exempt employees is to pay them for hours worked, not for hours they otherwise would have worked if you had not been closed, for example. If you're having a non-exempt employee work from home or telecommute, you're going to still have an obligation to follow the FLSA requirements, paying them a minimum wage, time and a half for overtime. Non-exempt employees working from home can become an issue on the issue of overtime. It's more difficult to manage and monitor that, so I'll just throw that out to you as something to consider. With respect to exempt employees, under the FLSA, you're obligated to pay exempt salaried employees their full salary in any week in which they perform any work. Very few exceptions. If they've worked a couple hours during the week, they get their salary for the week under the FLSA framework. So that's just sort of a brief outline of the application of the FLSA standards in terms of where things stand right now. Okay, so let's go to the next slide as well. Just briefly want to talk about any implications of the ADA. I mentioned that briefly, I think, before with respect to the COVID-19 coronavirus. Does this contracting the virus implicate the ADA? And generally speaking, for an infected employee, the ADA would not be applicable. It's viewed as a transitory condition, and therefore an employee infected would not have rights, remedies, etc., available to him or her under the ADA. Sending an employee home because they potentially have the symptoms of the COVID-19, would that violate the ADA? The answer is it would not be viewed as a disability-related action, given the transitory nature of the COVID-19 coronavirus. Okay, so let's go to the next slide as well. Now let's talk just briefly about workers' compensation issues. This question is raised by a number of companies, it was raised by a few of you in preparation for today's webinar. Obviously, for healthcare workers, first responders, this is a big issue. If they are infected with the virus in the nature and, of course, the scope of their employment, it's a big issue for them. But generally, the criteria would be that the worker obtained the virus as a consequence of their job. Potentially, a plant outbreak of the virus might support a workers' comp claim for a worker. But I think the prevalent thinking right now is that to the extent this virus becomes widespread, which it certainly looks like it will, at least become more widespread than it is already, it's going to be difficult for an employee to show that it's work-related as opposed to just the ordinary disease of life that they expose themselves to just by being a citizen of the public. So, and I will just go to the next slide and we'll sort of wrap up the issues with respect to workers' comp. I think it's an uphill battle for an employee to make the claim. There's also some language in a lot of the state workers' compensation statutes that actually list out compensable diseases as entitling a worker to benefits under the workers' compensation statute. Keep in mind that workers' compensation is a state-by-state kind of thing. Every state deals with it a bit differently. So you can't just make it a broad assumption. It's going to be state-specific. But I can't see that a workers' compensation statute would list the coronavirus as being a compensable disease. Some states actually will indicate that occupational diseases are only a natural consequence of being in a particular occupation. I mean, an example that comes to mind is if you're a painter, exposure to paint fumes, maybe some lung illnesses associated with that might be viewed as an occupational disease for a painter, but a exposure to the COVID-19 coronavirus for an employee designing, manufacturing, and delivering truss and floor components, roof and floor components would not be viewed as the natural consequence of someone working for a truss plant. And other states also state that if you can be exposed to this disease outside of work, it's not likely to be viewed as an occupational disease. So generally speaking, in terms of concerns that may exist outside of potentially a major outbreak of the virus inside your plant, and that may not even qualify. I think as a general rule, it seems likely that this will not be compensable under the workers' compensation statutes that exist at the state level. Okay, now before we get to questions, or any more questions rather, I do want to update you with a statute that was passed yesterday by the United States House of Representatives. It was passed with a large majority, passed 363 to 40. That indicates strong bipartisan support. The bill that was passed relates to paid leave for employees who are unable to work because they've got kids at home, because schools are closed or childcare is closed. It would apply to companies that are less than 500 employees. So that's going to apply to a large majority of truss manufacturers. The bill, as proposed by the House and as voted on by the 363 legislators, says that the first 10 days of leave are unpaid, although that employee would have the right to draw down on leave that may exist at the company level, paid leave or personal leave, although the employer would not be able to force the employee to draw down on that for the first 10 days. After that, you've got pay at 2/3 the regular rate, which means to me that it would not include overtime. Although a lot of times when legislators pass bills, they say we've got to pass it first and then we'll tell you what it means or what it says. But right now it appears that you're going to pay after the first 10 days, 2/3 pay for the regular rate that that employee was receiving prior to the work that they had leave, not to exceed $200 a day or $10,000 in the aggregate. Now, last night as I was traveling home, I heard a lot of talk on talk radio about would the Senate pass this, would President Trump also sign it into law? That's a question mark. There is some thinking that it might be changed by the Senate. I think they're scheduled to vote on it sometime this week, midweek, although we're now at Tuesday, so midweek to me means Wednesday or Thursday. And if they were to pass either the bill or more likely some similar bill, it would require further Congress or House of Representative action on, and the earliest the House is scheduled to meet is March 23. So this thing, if it's passed by the House, the Senate, signed in, the law could become law here perhaps as early as the end of March. So that's something to keep an eye on. If you've got a strong view of whether or not your senators or House of Representative legislators ought not to support this, and you want to let your view be known, because this is going to be a significant drain or a strain on small companies, from my view. I'm not quarreling with the issue that we have at hand, and that's the fact that we've got kids at home and employees having an inability to take care of those kids if both the father and mother are working, but nevertheless, it seems to be very targeted to small companies. One other thing before we get to questions. One of the attendees today actually asked a question about some statute, some law that exists in the state of California. This is a state issue, not a federal issue, that has to deal with enrolling in some kind of plan that allows you to reduce your workforce, say from 100%, at least the hours they work, let's say from 40 hours to say 30 hours or 25 hours a week, and then have those employees draw on unemployment while they're not working the full 40 hours for you. I took a look at that. It's California specific again, although other states may be looking at something similar to this. I don't have any opinions right now on whether that thing makes sense or doesn't make sense, although generally speaking, a lot of the things they do in California don't make sense. But nevertheless, with that caveat, I don't know what that really does to trust companies in the state of California. I would need to review that more closely. I downloaded 55 or 60 pages of materials that sort of discussed it. it didn't really come off the pages real clear or easy to understand to me, so it would take a lot more work on my part. So I apologize for not being able to answer that question, as it was one of the questions raised by one of the attendees today. Okay, with that having been said, we're at now the any other additional questions that you may have. Today, or I guess it was yesterday, in SBCA Industry News, SBCA published a summary or guide and frequently asked questions regarding the coronavirus for truss manufacturers. I was largely behind drafting that. I believe that has been circulated to the SBCA membership. Much of what you've heard today is already in that document as well. Our intent is to update that document as developments change. This issue, the issues with the virus seem to change day to day. So keep your eye on updates to that guide and FAQ document that is a distributed member benefit to all the members of the association. Keep your eye also out for this contagious disease policy that you can modify or adopt as a policy as part of your employment handbook. That should be available no later than tomorrow. Keep your eye out also for additional topics that will relate to the coronavirus in industry news as things develop as well. So with that having been said, anybody have any questions?
Kent, there have been a number of questions submitted during your presentation. Okay. There's a large number of them that are sort of related to what happens when an employee gets sent home because either they're showing symptoms of the virus or maybe they tested positive for it. What is the threshold for them to be allowed back to work? What should the employer, or what can the employer require for them to produce in order to come back? Is it just the 14-day quarantine? Do they have to have a doctor's note? That was a number of the questions.
Yeah, I mean, that's a very good question. I think that, and I've actually been thinking about that just today for a particular client. I think that I probably would require a 14 days allows that person to get clearance from a doctor. So I would require the employee to come back with an ability to work letter from their healthcare provider, which may include a test. Right now I'm not 100% clear on this testing process. The test can generate false positives from what I'm being told. It can generate false negatives as well. But at least it's better than nothing. So I think caution, prudence suggests a healthcare note, potentially with that person having taken the test, or at a minimum 14-day quarantine. And I'd want the employee to attest that they truly quarantine themselves, although there's no way to really monitor that. So more than likely it's going to require probably a healthcare provider release to work.
Related to that is if an employer has an employee who leaves the country and goes to some place that may be at high risk, and they come back, again, they haven't been sent home for any symptoms, but should the employer, or can the employer impose any sort of requirement before they come back to work?
Well, I don't know if you're going to know if the employee left the country. If you sent him home, or if he was sent, I mean, I'm not sure exactly how that would work, but you do have the ability to at least inquire of the employee whether they've been outside the country and where they've been, as you can ask that question as a condition to having them come back to work. So that, under these circumstances, you would have that ability.
getting back to the sending employees home for showing symptoms, is there I think you may have answered this question by saying they need to get a doctor's note, but is there a certain number of days that the employer should tell them you have to stay home before you can think about coming back?
Right now, the rule is 14 days, but then there's this 2% rule where they said within 11 days, most people, other than 2% of them, will have exhibited symptoms. So right now, everybody's suggesting you got to follow the 14-day rule. You know, that 14-day rule could be trumped by a doctor's release to work. As these tests become more and more available, that might be the quickest way to allow an employee to get released. If they show symptoms, they have a fever, for example, but then they get tested for the virus, they might be back to work, you know, once you've gotten the clearance from the doctor. Today was just one of the days that I went to see my physicians for just regular checkups, and I asked my family physician the question, you know, what's he seeing? He says, we're all waiting. They expect to see a lot more patients on the issue of whether or not they've been exposed and then having to get them cleared to go back to work. So I think he and his group are expecting a lot more people. So that would be the quickest way to get somebody released and ready for work.
Just a
And
point
from
of
what I
clarification
understand, the
that somebody
test
asked.
will be not charged by there would be no charge for the test as well.
Just a point of clarification based on your answer of sort of that 14-day quarantine. There was sort of this question of what if they go 24 hours without a temperature and they're not on any kind of medication? It's sort of like a threshold that I think daycare facilities have for kids, right? If your kid goes 24 hours without a temperature, then they're no longer infectious, kind of thing. Does that apply here, or is it still, no, you got to quarantine, or if you sent them home, they got to get a doctor's note to come back in?
You know, if you sent someone home for a temperature of 102 degrees, for example, and they come back and said, I haven't had a temperature for 24 hours, you take their temperature and they don't have temperature, I don't know that means they're not still infected. I think that's a little bit dangerous for somebody just to take it back. I think I might use more caution than that, require them to be tested or have a doctor's release. It's going to be, you know, it's one of those things. I don't know if there's the absolute right answer to that question, but that's right now what I mean, the last thing we want is to have a number of infected employees, correct? If you have one and then that person infects another or multiple employees, and then if the government in its infinite wisdom decides they're going to shut you down, just trying to be aggressive with respect to one employee, I think you're going to regret that and wish you hadn't done it. So I would use caution in that circumstance.
Another question that was asked is with regard, I think, to customer contracts. If at some point the virus has enough of an impact on a component manufacturer's ability to fabricate product in a timely manner, does that create any sort of situation where they have a standing with regard to getting out of a contract or altering a contract?
I think the person that fed you that question already knows the answer to the question. I'm kidding. Today I actually started thinking about the issue of projects that are getting shut down and therefore not being able to take delivery of products. And then as these projects open up, they're all going to want product at the same time. And it may, if President Trump's correct and we're going to get through this quickly and we're going to get back to a robust economy, we're going to have a lot of job sites that are going to want product quickly and immediately. And that's going to then cause this debate in terms of, you know, what the delivery schedule is really applicable. So on that issue, I've been thinking about some additional industry news discussion points, because I do think the contract is going to play a big role in that, but also the fact that we're going to have these job sites shut down, and then you know, people are going to have to sort of think through what their rights and obligations are. So I think there's more to come on that topic. be honest with you. I think, from what I understand right now, the project shutdowns have been more accelerated in the east to northeast quadrants of the United States, at least in a multifamily project type basis. I'm not sure about the single family, situation as much, because that's more, it's going to be more scattered and not as intense in terms of the size of the projects. But I think you're going to see a lot of multifamily commercial projects shut down temporarily, and that's going to cause a real pressure on product once those projects start to open up again, especially if our guys have the inability to produce because we've sent a lot of employees home.
Ken, one last question just for clarification. So if they have an employee that tests positive for the virus, I'm not quite sure what this question is, but they're asking, does that qualify under ADA?
So 80, in terms of that employee, if you send them home, is not going to have, and because it's viewed as transitory, that employee is not going to have any claims or rights under the ADA by virtue of having this virus.
Kent, that appears to be the questions that have been submitted. Are there any other questions that anybody wants to ask?
The takeaways today, I think, are, encourage your employees to stay home if they're sick, to take proactive steps to monitor symptoms of your employees in terms of potentially taking their temperature as they come to work, to take swift action if anyone appears to have the symptoms that relate to the virus, pay attention to what is going on day to day in terms of what updates SBCA provides. Keep your eye on this paid leave issue because that could be significant. So there's hopefully a number of takeaways that you've gotten through the presentation. And then in terms of this guide and FAQ document that's available in Industry News. So hopefully it's helpful. It's been helpful. And if you've got any additional questions or comments, please submit those to SBCA and we'll do our best to respond to them.
Kent, one last question. Have you read anywhere if an employee gets the virus, can they get it again after they get better?
I heard that question asked on the news station last night, and I listened to some smart person answer it.